Okay, so I think we have a little bit of time if for our comments or questions. I don't know that we have a way for the audience to do that conveniently. So in your practice, Steve, how many devices do you measure when you measure somebody's? Adi talked about measuring 3 different ways. What's your practice in that regard?
So our routine is all the measurements are done before the patient sees the doctor, and I use the Lenstar, it's an OPD, and then we use a Cassini as well, looking at the posterior corneal astigmatism. So I'll look at those 3. Now, if there's any discrepancy, sometimes I'll send them back for other instruments, other testing, but those are the 3 basic things that go for every patient before they see me.
Mike, and I noticed you make your decision right there on the fly when you see the patient. So you're looking at the topography, as I understand it, as well as the Lenstar measurements?
Yes, and in fact, it's really great for me because I'm actually getting 2 different measures off of 2 different mechanisms on the same instrumentation. And I used to also collect different topography information from other units within the organization. We have a ton of stuff at CEI to look at, and I found that most of that was really just a waste of time. As I migrated, I just decided that I'm going to use the instrumentation, which gives me the right answers, and I have both a qualitative view to be able to look at the topography, see if it makes sense, and the quantitative view on both the topography component of the T-cone as well as the measurements directly off the Lenstar diodes.
And even though it's the same device, it's 2 separate measurements, which I think is what's so important to understand, so that you have 2 separate data points to compare.
Well, in all fairness, it's not 2 data points. It's multiple data points which have been merged. What we're given on the printout is recognizing that there were numerous data points that are collected that are all overlapping and getting the same measures within a very tight tolerance. One of the nice things about the Lenstar unit for me is that if there is an outlier data point, it will flag that, and my team will look at the data point, and if it was not a well-captured image, it will extract that, remove that piece of data, and with the Lenstar, I can actually take out one piece of the data set and add in an additional piece without running all of the additional studies in advance. That can be particularly challenging if you have patients that have ocular surface issues or they can't hold still very well. If you have 4 good measures and a couple measures that the patient moved a little bit for and they're not as good, with this particular instrumentation, unlike some of the others, we can actually just remove the bad data points and replace them without getting rid of the good data points.
And one of the other nice aspects of it is you can actually look at the reflected mires and actually look at the true raw data, and you can tell right away that that's a bad measurement or a smeared point that tells you there's something amiss, in addition to the numbers that you pointed out. Warren, how many different measurements do you get?
Well, to go on top of what Mike said, one of the real advantages of the Lenstar is that you have access to every single aspect of the measurement. So when you have 5 or 6 axial measurements, you can actually see where the calipers are, you can adjust them, and if something doesn't look right, you can delete and repeat. And just to emphasize another point, we use validation criteria. So a measurement is only as good as our ability to know what it means. And if my staff looks at each and every one of the measurements, and if it doesn't meet validation criteria, they delete and repeat it. Not only do you have access to the reflective keratometry, you actually have an image, but the axial length, the white-to-white measurement, I mean, you can see absolutely everything. Instead of just looking at numbers on a screen, you can actually see how the measurement was done. For the white-to-white, for instance, we use that for sizing for an ACI well if you need to. You can actually take a caliper and move it in or out and move it up, down, all around and get the white-to-white exactly correct. So you're not just stuck with the number you're given, you have the ability to modify things and change things, and if you can't resolve it towards validation criteria, then you delete and repeat, and this is just a wonderful way to get good measurements.
So Warren, when I get a result that indicates it's out of bounds, do I ignore it and use another formula, or do I use it but use it with a grain of salt?
Well, right now the recommendation is if you have an out-of-bounds calculation, you don't use it. And I recommend that people use Barrett and RBF. You saw how close they are. These are 2 the two most accurate methodologies. And one of the great things about the LensStar is it has them, and you can set up your printout so that it has Olson, Barrett, RBF, and perhaps Haggis, whatever you want to look at it, and look at them all side by side. But my recommendations is that if you have an out-of-bounds indication, the formula is telling you, don't use me for this because I don't really have the data to support that calculation. And I would use Barrett instead.
Although it's remarkable how often the out-of-bounds calculation really is very close to what my other two that I use when I have them lined up are the Barrett and the Holiday one.
It's very close, but again, I don't have the data to support it. Now with this new version that'll be out with the calculator in August and out on the LensStar in October, the number of out-of-bounds points you're going to see is going to drop almost to zero.
So will we have the extended version, and you said on the LensStar itself in October, is that right?
Correct, October.
And how about the Abulafia Koch as well? When is that going to be available?
Adi, I think that's going to be October, right?
Yeah.
Yeah, it'll be in October. So everything you're seeing today will be part of the next LensStar software cycle that'll be ready to download in October.
Okay.
Well, thank you.
I think I hope you've enjoyed the session. Again, I want to thank Haag-Streit for sponsoring this, for giving us the opportunity to share this with you. And have a great afternoon. Enjoy the meeting, everybody.
Thank you.